Hello, Jeando.
Good afternoon, Kevin.
In the last video, we were talking about the phrase Alexander used in the early days of back and what that could mean. Related to this is another phrase, set of words that they use a lot in the modern Alexander technique is it's about let the back lengthen and widen, or how to widen the back. It's a goal or something they're aiming at, or something they're trying to do by thinking it in words. So, can you talk a little bit about what your understanding of widening the back means, and how do we know if it's actually widening? What's the way of the method for judging whether we're doing what we think we're doing or not?
Yeah, exact. Yes, I think it's a good, continuation to this idea of, having the back and the upper torso come forward. These expressions that were used in the first training course, as reported by quite a few Alexander teachers of the first generation. And so I think, yes, widening the back is a good example where very often we have failed to translate the words into practice. We have failed to, in fact, create some experiment where we could judge what Alexander meant by back. Alexander is not with us anymore. So nowadays, all sorts of teachers are there and telling you that these words are just something you can feel when they have their hands on you. Well, I tend to disagree with that. And I recently found in the new edition of Man's Supreme Inheritance by Jean Fisher, a very interesting quote. I want to share it with you to start that reasoning. So let's see. So this is Man's Supreme Inheritance, as you see, and there are different appreciations, and this one is from a certain Granger. It's said Professor Granger, but he's not a medical person. He's a literary doctor, you would say. He knows what he's talking about. He knows the value of words. And so here is what he says. I'm just reading from the picture I'm showing on screen. He says, one of the most urgent needs of the present time is a profounder analysis of the cause which determine the habitual movements of human beings. In the absence of adequate knowledge in this field, the ground is left open to empirical and one-sided attempts to remedy the obvious disturbances of the normal course of human development. Mr. Alexander, indeed, is concerned with the borderland which both separates and unite mental and physiological processes. So I do agree totally with that sentence. I think it's as true now as it was when it was written. And I want to make a technical comment on it, because what I mean by determine the habitual movements of human being is not what most people think. We want to determine the cause of, the concerted movements of human beings. And you will see I have taken a picture of a young student. I think she's in her third years, and she's in a training course of the modern Alexander technique, a somatic technique, to learn automatically the movements by being placed by a senior teacher. But at the moment, she's playing the teacher. I think the teacher is playing the student, and we will see what we mean by concerted movements and how concerted movements can, narrow the back instead of widen the back. How a series of movements can shorten the spine instead of lengthening the spine. And you will see that lengthening the spine and widening the back have a lot in common. Well, they have in common the same means whereby. So during our previous session, I looked at the work of one modern Alexander technique teacher that was describing how to go into squat and then come up. And I was objecting to his way of using the movements of the different parts of the torso, because like this is at the beginning of that demonstration. He says that he must think up, he will think up, and to demonstrate or convey that idea, surprisingly, is reaching up with his arm and is lifting the arm up, pointing the finger, saying, I will think up. Yet, while he's thinking up, there is something quite strange, is that his use of the different movements of the different parts of the torso and the different parts of the arm conduces to a shape that is a result of these concerted movements that has nothing to do with lengthening the spine. I consider that here we have a case of shortening the spine, despite the fact that the man may, in fact, feel lightness and freedom. I do believe that the gentleman is so used to his way of moving the different parts that he does not realize that he's shortening the spine and protruding the abdomen, pulling the head back. I think that he's got the lightness and freedom in his mind. Now, these words do not correspond to the objective, sequence that we see on the video. And so it's very important to make a very clear statement at first that when we say, or Alexander says, and I'm getting that sentence from Man Supreme Inheritance once again, at the near the end of the book, and he says, the properly coordinated person employs a due amount of tension in such a way that the tendency of the spine and leg is to lengthen. And the equilibrium is such that the undue pressure through the floor is absent, and there is a lightness and freedom in the movements of such a person that is most noticeable. Well, it's most noticeable to someone watching that video is that the pressure onto the floor is really at the front of the foot, because all the weight of the upper torso, middle torso are forward of the ankles. Therefore, that person is really somehow, directing the movement of the back, which is the middle torso, the lower rib cage, forward. And we will find that this is something that you may see of your own movements, of your own postures when you're performing in front of a camera. And that, of course, for me, these represent harmful manifestation that result in a certain incorrect psychophysical use of the organism. I consider that the person is making decisions, and therefore we have a psychological aspect. Making a decision is not physical, but that person is making a decision to allow, produce or do some movements and refuse to do other movements. So it's a psychophysical use of the organism. For Alexander, the case is very clear. He says this would indicate that the sensory appreciation in the sphere of guidance and control of the psychophysical mechanism concerned must have become unreliable and defective. And in the present instance, as far as the observation of the teacher is concerned, certain defects must have been particularly noticeable in the use of the breathing organism. And so the breathing mechanisms here are apparently misused, and we need to, go to the bottom of that and see in what this is effective, why it should be changed. And as I said, there is more reason to do that. That is not a strange or bizarre performance by one particular individual. When we look at the young student that I was talking about, I've just taken this picture from the internet. And so we see that, the person is, putting her hands on the head of somebody. Yeah, it's in the somatic Alexander technique where you want to communicate proper use to your pupils through the touch. You are supposed to communicate your own capacity of organization to someone else through the direct contact of your hands. Well, but what is apparent on this picture is that the student has formed a muscular habit of protruding the abdomen or lower rib cage forward of her head, independently of her conscious control. She doesn't know she's doing that. The line of suggestion set up by the wish to lift the hands induce at once apparently a reflex action of a complicated set of muscle. She has learned to do this somatically, that is automatically, and at first she will seem to be incapable of controlling movements of the shoulder, rib cage, and lower rib cage when the wish to place the hands is initiated. So at the end of 3 years of training, this is unfortunately very, very common. And it's necessary to use a video camera or a camera in order for you to discover what it is you're really doing with the movements of the different parts of the torso and with the mechanism of the arm when you're reaching forward. You would be so surprised. This is very common. But here, the analysis shows that, of course, there are bony structures inside, well, the envelope. And these bony structures can be easily reasoned, or their movement can be reasoned out. And we can see that when we get, that's it, the lower sacrum directed backward, and what you would call the back of the belt. If she was wearing a belt, you would have the front and the back of the belt, and you would see that the back of the belt is very far forward. So the base of the lumbar spine is forward of the lower sacrum. And we see also that the shoulders and well, the thoracic rib cage, the thoracic spine associated with the thoracic rib cage is far back. All the conditions are ready. You need 2 directions backward, 1 direction forward to get a shortening of the back. As well as the shortening of the back, of course, you get a very interesting argument, is that if you look at what is forward, you look at the person from the side, and you must decide what is forward. Well, you will immediately understand that at the moment, what is forward is the lower rib cage and abdomen. The person is retracting her head relatively to that spot, and what is closest to the pupil is the abdomen. It's certainly not the head. So you cannot say that in this sequence, the person is showing what the head forward could mean. Or you have to, well, discuss or question this idea of head forward. Is it head forward and up? Is it still valid nowadays? Are there other ways to understand it? Of course they are, and you will see there are many different options to get the head forward. At the moment, my reading is very global. I say at the moment, if I look at where the abdomen is, where the head is, it's absolutely obvious that when reaching the pupil, the person is arching the upper torso, the neck and head backward relatively to the sternum. And so there is a shortening of the back, yeah, but now it's necessary to understand why I can say that these images are all pointing to the fact that with this shortening, you have a narrowing of the back. So, well, it's necessary to start discussing this concept of narrowing the back. And the best thing is to start with what Alexander had to say. So, Alexander, in the previous sentence, said that there must be some interference with the breathing mechanism. So you have to go to the breathing parts of his books. And that's where I took that new quote. So I'm reading from what is on the screen at the moment. Here is the sentence written by Alexander in the first book, Man's Supreme Inheritance, page 195. Most people, if asked to take a deep breath, will proceed to, I use the word spoken by thousands of people I have experimented upon, suck air into the lungs to expand the chest. Whereas, of course, the proper expansion of the chest as a primary movement causes the alea nasi to be dilated and the lungs to be instantly filled with air by atmospheric pressure without any harmful lowering of the pressure. So suddenly we are discussing the proper expansion of the chest, like widening the back as something to do with the chest, with the back of the rib cage. And why is there this notion of the back of the rib cage? Well, it's quite simple. You just have to follow Alexander, because he does give a sort of presentation of what he means in his own mind with the word widen the back. This is found in the second book, Conscious Shift, Conscious Control of the Individual, page 110. And he says, widen the back. What really occurs is that there is brought about a very marked change in the position of the bony structures of the thorax, particularly noticeable in a posterior view taken, also a permanent enlargement of the thoracic cavity, with striking increase in thoracic mobility and the minimum muscle tension of the whole of the mechanisms involved. Well, it's as if we have gone the whole spiral back to the same post, because we finished by that idea of minimum muscle tension. So is that something I should feel? Should I feel that there is a minimum muscle of tension when I have the permanent enlargement of the thoracic capacity? It's exactly the opposite of what I think. It's not at all the idea. But when we widen the back, we do not widen the back by breathing in. Apparently, you have to widen the back before breathing in, because widening the back leads to a permanent enlargement of the thoracic capacity. If breathing was totally associated with the result we call widening the back, then we would be widening the back when we take the breath in, when we take a deep breath. No, for Alexander, this is the wrong idea of primary movement. I've heard so many teachers discussing the primary movement as this expansion of the ribcage when you breathe in. Well, if you follow that route, you must think that, of course, there will be a second sequence where, after expanding the ribcage in breathing in, you have to, well, narrow the ribcage in breathing out. But for Alexander, this is not the point. This is absolutely not his way of thinking. He thinks that it's possible to obtain a permanent enlargement of the thoracic capacity before taking a breath. After taking a breath, we can maintain the enlargement of the thoracic capacity even in breathing out. For most of my students and teachers, this is a real headache. Yes, they can't see how we can widen the back permanently. And so it's necessary to create a practical experiment. It's necessary to translate all these words into something that could make sense. And that is not that difficult, in fact. I do it with all of my students. So here is one of my students. You can't recognize him because I have forgotten to put his head on the screen. And well, let me explain what's happening here. So we have this man is a teacher of the somatic technique, but he's having lesson with me, and we are discussing what we mean by widening the back. Because he's of course heard this idea of spine to lengthen and widening the back. All his of course training course and all the years he's followed the somatic technique, but he had not really got the point and what it is. Well, The first thing is to notice that there are two spots that are set on the mechanism of the arm. They are very easy to locate. Anybody can conceive these spots. Conceive means imagine, yes, but it's not a pure imagination. It's an imagination, a technical imagination has to be related to something you can easily describe and control. So how do you describe the front of the internal part of the arm? Well, I asked first the student to locate the armpit and how high he can go with the fingers under the armpit, because you can go just up to a certain height. What will happen is that the tendon of the massive muscle of the back, the latissimus dorsi, is attached at the front of the humerus, and it will stop your finger from going up. So that gives you the height, the actual height of the armpit, and at the very front of it, on the internal side of the arm, you can locate where is the, well, just the front of the bone, the front of the humerus. That gives us, well, sort of an axis, because I can draw a line between the two. Of course, the pupil has to imagine all these things. But then I will convey the pupil to another act of conception. I will ask the pupil to imagine what I call a lower thoracic belt. That's why the pupil at the moment is seen with the third finger forward, the thumb is at the back, and I've asked the person to place these fingers, the third finger, as you can see, on the lower part of the rib cage at the front, and I asked him to place the thumb at the lower part of the rib cage at the back. I asked the person to imagine that there is a belt. No, not the belt, the trousers belt, but a belt, a lower rib cage belt. And what I ask the person is to create two concerted movements. I'm asking the person to make sure that he can move the lower rib cage backward relative to this axis of the front of the internal parts of the arms. To make sure, this is not an experienced student with me, he's a teacher, but he's no experience of concerted movement. So in order to help not moving the arm and the lower rib cage at the same time, we will see that for most teachers, they have a tendency when moving, for example, the rib cage, the arms forward, you will see that the rib cage has a tendency to follow. Yeah, so you imagine that the reverse is going to happen as well. That is, if I ask the person to move the lower rib cage backward, it's a simple movement. There is nothing extraordinary in that. Well, there is every chance that the person, without knowing it, is going to move the front of the internal part of the arm back at the same time. So to help the student and prevent the unwanted movement of the shoulders going back when the middle torso is going back, I've asked the person to set the tip of the elbow in front of the wall so that, well, the upper part of the arm, the internal part of the arm and the elbow cannot go back. At the moment, they are prevented from going back by the wall. And I will ask the person to see whether it's possible to stay standing, of course, moving the middle torso back. You would say, well, this is the explanation of back. Yes, but you will see the consequence is interesting, because the consequence will lead to understanding what we mean by widening the back, and more importantly, what we mean by the proper expansion of the chest. This is a conception that is absolutely clear in the initial Alexander technique that we teach. It's not just well, a sort of mantra that we repeat. No. It has an exact and definite explanation. So this is the start of the idea. And I make the student notice that, well, the person is like standing with the middle torso, the lower rib cage, forward of the shoulders and forward of the head. We are back into the same consideration where that person, for example, is standing with the lower rib cage very far forward of the shoulders. As a result, the upper thoracic spine is back, and it's impossible then to get the neck and head forward. without going down. So we have exactly the same attitude. The teacher can be just finishing her training or having taught the somatic technique for more than 10 years. Same attitude to start with, yes? So we are going to see that using verbal instruction, the conception of the movement being explained to the pupil so that the pupil can realize what it is we are working with. We are working with the opposition of movement between the mechanism of the arm and the lower rib cage, the middle torso. And so this is the first attempt. Look at this. There is a drastic change. And if you continue, you get from the first to the last. Something has happened, obviously. Something has happened to the width of the rib cage, yes, and something has happened also to the height of the rib cage. So we can see that suddenly the proper expansion of the chest means that you start from a very forward position of the lower rib cage and abdomen, and then you go back. At first, the tendency is for the pupil to come down with the upper torso, but this also can be changed so that the person can really will lengthen the spine. Now, when we start, the pupil has the sternum inclined backward at the top, forward at the bottom. It's very, very simple to check. You set a simple stick on your sternum, and you will see the direction of inclination of the stick. And when the pupil starts, we have what we call the undue lifting at the front part of the chest that Alexander was pointing. And he said, Alexander, that this undue lifting of the front part of the chest is associated with a protruding abdomen and a shortened spine. Well, yes, exactly. That's the adequate understanding of concerted movements. As the person is starting to move, we can see that there is a definite dimension of getting the sternum more and more vertical and also lifting the rib cage away from the pelvis. Well, some people will, maybe say that there is very little lifting. Wait until you have a lesson, because the tension that will come out of these movements is at first felt as impossible. The other week, I had this new student saying to me, but this is real difficult. This is really hard. And I say, well, it's a new coordination of movements. It's a new coordination of gestures, and you're not used to these, muscular mechanism coming into action. So at first, it's like when you start an activity you've never done before. You're not trained for it, so it will feel excruciating. And second, intellectually, it's also very difficult because you've always believed that you should feel light, you should feel, this is not a dreamland, you know. When you start concerting movements in a new coordination, you have to go through these phases. So now, what is the experiment about? Where can we say that we widen? Well, that's where the experiment becomes interesting, because there is this lower thoracic belt that the pupils imagine. But more than imagining, I'm asking the pupil to, establish what is the distance separating the indexes at the front, or the third finger at the front, and what is the distance separating the thumbs at the back. Remember, the pupil at the thumb touching the back of the rib cage. And I encourage everyone to start and play with these experiments, rotating around the front of the internal part of the arm, having the rib cage go forward and having the rib cage go back. Well, creates a massive change in the geometry of the rib cage. When the person is standing with the abdomen forward, yes, like we have this person, you can be certain that the front of the lower thoracic belts, is very wide. Alexander point the fingers and say it's a matronly attitude. By matronly attitude is very massive widening at the front of the rib cage, and this is associated with the shortening at the back, a narrowing at the back. You have to create these experiments where you're starting to bring the lower rib cage backward relatively to the front of the internal part of the arm, and make sure that this is not just a feeling. Go against every feeling of tension you have and hollow the front, widen the back. Hollowing the front means you're narrowing the distance. The distance between the fingers at the front is really narrowing. Yes, it's not some sort of imaginary concept or suggestion. No, no, no. You want to measure. You want to make sure. And you will notice that suddenly, well, you feel a lot of tension at the front. And you feel also a lot of pull at the back because, of course, the tension in the front is suddenly the transverse X mechanism of the muscle of the abdomen are starting to come into action, but at the same time, well, you have a massive widening at the back. And this goes with what Alexander, remember, was saying, a very marked change in the position of the bony structure of the thorax. So the marked change is not just that the top of the rib cage has to go very far forward and the bottom of the rib cage has to go back. This is what you see from the side, but Alexander points to what is seen when we have a posterior view. The posterior view has nothing to do, you cannot see how the sternum is organized. What you will see is that suddenly you have an expansion of the back of the rib cage, and well, for Alexander, this is the primary movement. And this proper expansion of the chest, then you can play with it and discuss this next sentence, the permanent enlargement of the thoracic cavity. Is it possible to breathe in and to breathe out, continuing to widen and continuing, I insist, to lift the rib cage away from the pelvis? Remember that there is not only that first movement very often you will find is associated at first in the wrong coordination of movement by a pulling down of the cervical spine of the neck and the head. This is associated, you will see, with the conception, the old conception of the movement, but it's possible also, and we see here something different, is that suddenly the gesture is different, the person is getting the back to widen, but as you will see, the sternum is not pulling down, the sternum is starting to lift in between the arms. And so this is a real massive change in the coordination of the concerted movement of the mechanism of the torso relatively to the mechanism of the arm. This is supporting the torso with the arms. So when we observe, well, the concerted activity of a person that is incapable of controlling the movement of the shoulders, rib cage, and lower rib cage at the same time, when the wish of the hand is initiated, this is just the start. This is just the beginning. Well, here she's in the end of her training, but she has to start the difficult business of experimenting with coordinating the different movements. And so I want to come back to this wrong mechanism and wrong conception. There are these ideas that head forward, yes, head forward and up, should be from the first vertebrae, from C1, yes. And what I notice is that if you start pushing the head forward, let's imagine you decide that no, you don't want to live with the head behind your abdomen. Instead of encountering the world with your abdomen in front and your head very far back, you think, okay, I'm going to direct the head forward. But there are different possibilities. The first one is to just think that many teachers, including first-generation teachers, have, thought and declared that head forward was just a rotation of the head relative to C1. Well, if that happens, you will see two things. First of all, you will see that nowhere is it possible to get the head forward off the abdomen when you're rotating around C1. And second thing, you will see that the person has a tendency to go down with the nose, chin, and the whole front of the head. It's going to be very difficult to lift the sternum in that case. A second possibility arises. It's if you forget of the first head forward and up, then you think, okay, there is head and neck together. And you could get, instead of rotating forward and up relatively just to C1, you can rotate relatively to C7, yes, the base of the torso. Again, when you rotate from there, you go forward with the head, and you don't find any forward and up movement, you find a forward and down movement. And so you think, wow, so it's impossible to go forward and up with the head. I have read recently a modern Alexander technique teacher with more or less correctly said that it's impossible to go forward and up with the head. Well, yes, if you analyze the movement in that way, I'm afraid it's right. Yet another possibilities, you have to explore everything. You never know, yeah? So suddenly, you start to imagine that, yes, the middle torso is forward of the head, but the middle torso is also forward of the upper torso. The sternum bone is completely part of the upper torso, and the top of the sternum bone is very, very far relative to the lower sternum bone. So the person is raising the hands, but is getting, well, the base of the neck back. So would it be possible to get the base of the neck further forward? And there is more lever arm, could be easier to reach forward of the abdomen. But again, the same difficulty arises. I am pointing to this solution because many times, despite having explained where is the correct center of rotation of that motion forward and up, most Alexander teachers and students alike have a tendency to try and get the upper torso, neck, and head forward relatively to the spine, because they think that, or they conceive more or less consciously, that the center of rotation is at the back, because all their lives are, for example, when that person is arching the upper torso, she's arching her upper torso relatively to the back, to the spine. And so when you ask the person to readjust this movement, the person will tend to readjust the movement from the same center of rotation. And if that happens immediately, it's absolutely obvious you will see the collapse at the front of the sternum. You will see everything go down. When you see this, well, that means only that the old center of rotation is still active, is still preempting the actions. So what is the last possibility? But the last possibility, you will discover that when the person is rotating from the back, well, the only possibility is to draw the ribcage downward at the front, yes? So, well, now, if you want to imagine something bizarre, you can say, why could it be possible to, well, conceive a center of rotation that has nothing to do with the spine? An imaginary center of rotation that would be, well, at the front, for example, at the lower sternum spot. It's possible to demonstrate to a person that the person can lift the lower sternum spot instead of dropping it. I insist on that point, because if you do not start the experiment with that, you will find that the person has no capacity to inhibit the old center of rotation, and the person will tend again to, well, rotate the upper torso relatively to the back of the spine. We start to think, okay, could it be possible? And like, instead of going down, do exactly the opposite, lengthen the back to get the head forward and up. And so, wow, that could be possible, but doesn't work. that is forgetting that there is a rib cage, and that the rib cage will not, it's not possible to separate the rib cage in two. But there is something else that is possible. And that's what I have shown when I've shown these images, is that it was possible to rotate and lift the rib cage. It was possible to imagine that the upper torso could come forward. Yes, but that's only possible if the middle torso goes back. This is only possible to go forward and up with the head if you lengthen the spine, yes, away from the pelvis, and if you widen the back by going back with the middle torso. And when the person is going to introduce these movements, you will notice that there is now two rotations that have to be changed at the same time, because as you can see, it's not only the middle torso relatively to the upper torso that are creating the shortening. Of course, the person is rotating the pelvis as well. So when lifting the hands, she's doing things with the shoulders, with the middle torso, with the lower torso, which in fact brings as a consequence a tightening of the neck and the position of the head backward relatively to the abdomen. So this is an imaginary theory. I'm saying to the person, look, could it be possible when you want to lift the hands to, in fact, rotate the lower rib cage relatively to a line that you can conceive in your mind? And that in rotating that line, we know that you're going to experiment with narrowing the front of the torso and widening the back of the rib cage. It's impossible to answer these questions without trying, without entering into the experiment. So this widening the back is at first a theory. It's described in the books, but it's also something that you can only conceive and intellectually represent and physically perform when you have done a few experiments under the eyes of somebody that can see what is necessary, what are the unwanted movement we don't want to see, and what are the correct direction of certain activity. This is the purpose of the lesson of conscious guidance and control.
If we go back to the first slide you showed, where you had the quote from Professor Granger talking about Alexander.
Yeah.
He said in it that the way is now open for it because there's no solutions, because of the absence of adequate knowledge. The ground is left open to empirical and one-sided attempts to remedy the obvious disturbances. And what does he mean there by one-sided? Does this just mean like one person trying on their own, or does he mean something else?
No, I think it means something else. Well, my understanding of the sentence, I'm sticking to the environment. The environment is we are discussing psychophysical activity. What is mental? What is physiological? So the one-sided attempt is, for example, modern Alexander technique teachers, they are basing everything on the feeling they can give to the person, which is a physical thing. Yeah, you have others that are whole into the mental aspect. Feel free, feel easy. This is more for me the mental aspect. They are trying to suggest in their mind something that should influence their whole behavior. No. With exactly as Granger is explaining, with words, we can separate. That's what I've done during this lesson. This moment with you is I have separated the parts. I have separated the movements. I have instead of having an experience you cannot say anything about, I've started to separate things, and I've separated the mental conception and from the physical movements, and then I have reunited. I have shown how you can use an experiment to suddenly bring consistency, bring physical movements to comply with the instruction you're giving yourself. So for me, this is the one-sided attempts are either too intellectual, too feeling good, feeling nice, feeling unite, feeling perfect. There are many different declinations in the Alexander technique and in other somatic techniques, by the way. And the other one is, of course, the physiological processes. Yeah. So making somebody experience with your hands something that should be right. Yeah. Physical or mental, separated. We think that Alexander indeed reunited both mental and physiological process through the capacity to guide and control the translation of verbal instruction into concerted actions. So you describe the concerted action before they happen, you measure, you express what are going to be these marked change in geometry of the bony structure, and you let the person experiment. If the person suddenly discovers that when wearing the lower rib cage very far forward of the front of the internal part of the arm, there is a widening at the front and a narrowing at the back, then suddenly the proper expansion of the chest make no question. We know what is the improper expansion of the chest. The improper expansion of the chest is there. It's when look at the number and the width of the ribs that are in front of the internal part of the arm. That person is really, really widening, opening the front of the rib cage and narrowing the back. So we are at the frontier. We are at what is talking about the borderland between physical and mental. Yeah. That's how I understand the sentence. Anyhow.
Excellent. That's great. Okay, for people watching the video, you can find a link to Jeando underneath, and you can book a one-to-one lesson with him if you want. And thanks, Jeando. We'll see you in the next video.
You're welcome. Bye.
Thank you. Bye-bye.